MBI stands for molecular breast imaging. Its technical names are scintimammography, miraluma, sestamibi, or just breast-specific gamma imaging. It's a nuclear medicine procedure that uses a radioactive tracer and a special gamma camera to detect breast cancer. It is a type of functional imaging, meaning instead of just pictures, it actually creates differences in the behavior of the cells rather than just the appearance. So it can detect tumors that may look the same as background tissue on a mammogram. The radioactive tracer that is injected will travel to the breast tissue and attach to all fast-growing cells like breast cancer cells. MBI is considered a supplemental screening tool to accompany a screening mammogram. It requires a doctor's order and the mammogram is done first. The main indication for MBI is for women with dense breast tissue. Dense breast tissue appears white on a mammogram, as seen in the CC image on the left side of this poster. Cancers can also appear white on a mammogram, which can make breast cancer more difficult to detect on a woman with dense breasts. Other indications for MBI can include women who are BRCA gene positive, women who have previously had breast cancer, those with inconclusive mammogram results, and for patients that have persistent pain in breasts or palpable finding but have had a mammogram with no abnormalities. Another important indication for MBI is when a patient is unable to have an MRI due to a contrast allergy, claustrophobia, or an internal implant device that cannot be near the MRI magnet. MRI is also twice the cost of MBI. However, MBI, being a fairly new procedure, has to be cleared through your insurance company to make sure that it is covered. The procedure for MBI has some similarities to having a mammogram. No deodorant powders or lotions the day of the exam, and the patient will undress from the waist up. Patient needs to fast 3 to 4 hours prior to the exam to increase the amount of tracer that travels to the breast tissue in order to create better quality images. Once dressed for the exam, a nuclear medicine technologist injects the small radioactive tracer called TC-99M sestamibi into the patient's vein. A warm blanket is placed on the patient's shoulders to increase peripheral blood flow to the upper torso, which will improve breast uptake of the tracer. Patient is seated in a chair with a pillow behind their back for comfort and to keep the patient in place. As with a mammogram, a CC, MLO, and ML projection will be performed. Light compression is used, but just to keep the breast in place. Each projection is 10 minutes long. If you have both breasts done, you will be there for 60 minutes of imaging. After all the images are taken, the tech will contact the radiologist to look at the images and make sure more images aren't necessary while the tracer is still active. As you can see in the image on the right side of this poster, the patient indeed had an uptake of tracer in that same dense area of the left breast that we saw on the mammogram image on the left side of the poster. Her mammogram had been read as category 1 or negative. The radiologist's recommendation stated that the patient may benefit from supplemental screening with MBI, as this has increased sensitivity for detection of cancer, which may be obscured on the mammogram. The patient's MBI results read as patchy asymmetry uptake in the upper outer quadrant of the left breast. He recommended the patient return for spot compression views and a targeted ultrasound on the left breast for complete evaluation. After spot compressions and ultrasound were performed, it was determined that the left breast had a 1 centimeter benign glandular adipose cyst behind the nipple and benign retroareolar duct ectasia. The radiologist told the patient the MBI uptake of the tracer was indeed a false positive. False positives are not unheard of in any medical procedure or test. Some healthcare professionals feel that MBI is an unnecessary step and that the ultrasound is the gold standard of evaluating dense breasts. However, not all facilities utilize the after-breast ultrasound, or ABUS, as a supplemental screening tool for dense breasts that have had a negative mammogram reading. Another exam facilities will utilize is a breast MRI, but the indication for the MRI is to have other risk factors, not just dense breasts. The patient on this poster is actually me, and I will say that the time between the MBI and the additional views with the ultrasound was an extremely stressful and anxiety-filled week for me. After hearing that the MBI was a false positive uptake, I personally would rather have had the ultrasound as my supplemental screening exam. But I do believe there is a place for MBI, and that MBI will become a more frequently utilized supplemental screening tool in the future.